Which of the following are correct? Select all that apply. Option A, 200 ml of ice chips is recorded as 200 ml of intake. Option B, 120 ml of ice cream is recorded as 60 ml of intake. Option C, gelatin is recorded as intake. Option D, solid foods such as toast are recorded as intake. Option E, urine and emesis are recorded as output. Now pause the video and think about the answers. Let's talk about intake and output here. What all things are considered as intake? Any oral liquid, any food that is liquid at room temperature like ice cream, gelatin, popsicles, tube feeding and any flushes that you have used, IV fluid and blood product. What all things are considered as output? Urine, emesis, liquid stool, drainage and suction. Now very important thing to keep in mind. Whenever you are documenting intake, ice chips if patient has used, then it is going to be documented as a 50% of the measured volume. What that means is if patient has used 200 ml of ice chips, then we are going to document 100 ml as intake. For ice cream, full measured volume will be documented. Meaning if patient has taken 200 ml of ice cream, we are going to document 200 ml as intake. Now look at the options here. 200 ml of ice chips is recorded as 200 ml of intake. That is actually wrong. Why? Because we just talked about 50% of ice chips will be documented as intake. So the correct answer is going to be 100 ml. For ice cream, full measured volume will be considered as intake. So if patient has taken 120 ml of ice cream, the total intake is going to be 120. So here this answer is wrong. Gelatin is liquid at room temperature, so definitely we are going to consider as intake. Solid food we are not going to consider as intake. Urine MS is definitely we are going to consider as intake.